Well, hey there. Welcome back to this month's email newsletter from Superior Physical Therapy. I'm Andrew Gorecki, here to share with you more what I hope is super valuable information for anybody that's out there that might be struggling with pain while they move, or just the people that want to try to continue to be pain-free, maybe because they've been here as a patient and they don't want to go back to where they were before. So this month's theme is sitting. Sitting has been kind of a trendy thing that has been focused on in the news and in medical journals, and just kind of, I think it gets a bad rap. You know, I know that the average person sits for 10 hours a day. That's amazing. I always think it's funny when you get people that go to work for 8 hours and then they drive for an hour and then they go to the gym and sit on a bike for another 2 hours. You know, we sit a lot. And what has been the trendy discussion lately has been not sitting. So stand-up workstations has been what I've seen in a lot of companies. Even in our own company, we have many stand-up workstations, which is a great idea. But not everybody is as lucky as we are. We get to stand all day. And to be honest with you, that's probably not the best strategy. That's a strategy that is basically called activity avoidance. So that's like if I have somebody that comes in and says, I have back pain with vacuuming, my first response to them is, well, stop vacuuming. That doesn't make a whole lot of sense for them. So by telling people to stop sitting, it's kind of like the same advice. It's activity avoidance. My style, and what I've learned from one of my mentors, Gary Gray, is that in order to be successful during an activity or a position, we need to have what's called a buffer zone. Okay? So meaning basically I need to have more motion or strength than what the activity requires for me to be successful and injury-free or pain-free. So you think about sitting, it's like, well, sitting doesn't really require a lot of strength. It does require some strength, and I have had patients that need strengthening to sit. But for the most part, sitting is a position that requires a certain degree of mobility in my body. And we know that the main area that needs mobility is the hips. And so if I don't sit, I'm never going to get better at gaining that mobility or that buffer zone so that sitting is not painful for me. And really, the concept of a buffer zone is very simple. It's complex, but let's make it simple. If I take my body to its limit of motion, that limit is a stressful situation for my body, whether that's my tendon or my muscle or my bone. If you take the body to its limit and beyond its limit, it can be dangerous. You can break a bone or tear a muscle or tear a ligament. But so the closer we get to that limit of motion, the more stress that there is. So the key is that to recognize that limit of motion is not a fixed limit. There are some fixed limits, like bones, joints have a fixed limit of motion. If I take a joint too far, I can dislocate the joint or break the bone. But the soft tissues of my body, their limit can change. And so the key here is to change the body's ability to tolerate sitting so that it doesn't feel like it's at its limit all the time. Hopefully that makes sense. We'll just call that a buffer zone. So Gary Gray calls it going deeper. We're going to actually go deeper in the sitting position in order to make it not so stressful for our body. The two most common complaints that I get from people that sit a lot are, number one by far is my back hurts. I either have back pain or sciatica, and sometimes it's the SI joint, but in that region back here it can be painful. The second most common area is my head and neck. Either I get headaches or my neck hurts or it's stiff or I get pain down my arm from a nerve in my neck. So neck pain in general, that region, and low back pain are the two most common. Today I'm going to show you a strategy on how to make your body have a buffer zone so that your back doesn't hurt as bad. Tomorrow I'm going to show you how to do a routine to make your neck not so stressed out from sitting. So hopefully you guys enjoy this, and let's get started. So in the sitting position for my lower back, the best thing I can do is have hip motion. If my hips are doing the motion or they have motion that's left over, that buffer zone, my lower back's not going to feel so affected. However, if I don't have motion in my hips, what will happen typically is you'll notice that people will start to sit like this. Their back actually rounds out. And what that's doing is it's the back, the spine is actually giving the body more of a buffer zone. And you don't really want the back to be doing a lot when you're sitting. In fact, research shows that that's called sacral sitting, slouchy sitting, sacral sitting. Research shows that sacral sitting like that is actually more stressful on the discs and the spine than deadlifting your body weight. So very stressful for the discs and the spine. So we're going to give a buffer zone to the hips. We want to have more hip flexion than we actually use in the sitting position. Okay, so we're going to do this. The first thing I want you to do is sit on the front edge of the chair. Okay, I want you to have your feet shoulder width apart, and I want your lower back actually to go from a sacral sitting to a neutral spine. So what you do there is you basically tilt your hips forward, and you're going to hold that position in your hips so that your hips are doing the motion and not your spine. Okay? So we're going to take, actually maybe I'll stay facing this way. So the first thing we're going to do is feet are shoulder width apart. I'm going to bring my pelvis forward, control my neutral spine, and at the same time I'm going to take my hands and reach down as far as I feel comfortable, and I'm going to do that reach down 5 times. Okay, now I don't want to go so far that I round my spine out. Okay, I want to keep that neutral spine. 5 times I want to reach down. On the 5th one, we're just going to hold it for maybe 10 to 15 seconds. And then I'm going to come up. Now, that's our first motion or position with our feet. We've got 6 more. Now I'm going to go wide with my feet. Okay, so we're going to go wide with my stance. I'm going to, again, rock my pelvis forward, keep my spine neutral, and I'm going to do reaches down towards the ground as far as I feel like I can. Wow, I feel that in the inner thigh. We're going to do 5 reaches, and on the 5th one, we're going to hold the reach, 10 to 15 seconds. Should feel this in the inner thigh. Keep those feet straight and wide. Now, 3rd motion position, we're going to go feet narrow. Again, rock the pelvis forward, keep the spine neutral. We're going to do 5 reaches forward. Last one, we're going to hold 10 to 15 seconds. Good. Now, let's put the right foot forward and the left foot back. So I call this staggered. We're going to have a staggered position. Again, rock the pelvis forward so the spine is neutral and not rounded. And we're going to do 5 reaches forward. Now, immediately when I reach forward, guess what I feel? The front of this back leg, this hamstring. Ooh, boy. 5 reaches forward. And on the 5th one, remember, you're keeping your spine neutral so the motion's coming from your hips. And then hold that last one 10 to 15 seconds. Then we're going to go left foot forward, right foot back. Arch that back a little bit. Reach down 10 to 15 times. Reach down 5 times. And then hold the last one 10 to 15 seconds. Interestingly enough, this side for me feels very flexible. This side doesn't. We'll talk about that later. Now, 2 more. Feet together, but knees out. So you're like this. 5 reaches down. Last one, hold 10 to 15 seconds. And then feet normal width apart, but knees together now. That's a hard one for me. Whew. 5 reaches, and then hold the last one 10 to 15 seconds. I want you to try to do this one every single day, maybe multiple times a day, depending on how much you sit. And I promise you, in 2 to 3 weeks, you'll notice that sitting is much more comfortable. I hope you enjoy this segment on sitting. I want to mention that this month, anybody who has any pain with sitting, low back pain, neck pain, doesn't matter what part of your body is hurting you. If you have pain with sitting, we're offering 10 free assessments, 20 minutes one-on-one with a doctor of physical therapy. We only have 10. They fill up every single month. Simply either reply to this email or call the number listed in the email, and we'll set you up with one of the free assessments we have available. I'll see you tomorrow.